Hi, I'm Dr. Chobot at Covington Veterinary Family, and this is Henry, my Cavalier King Charles, who's awfully busy today. I wanted to talk with you a little bit more detail about what dentistry at Covington Veterinary Hospital is like.
How many teeth do dogs have?
Dogs start out with, as an adult, 42 teeth, and there are some dogs with anomalies, different numbers and individuals, but most average dogs have 42 teeth. But as babies, they start out with 28. They lose all those baby teeth by 6 months of age, and all those adult teeth come in.
What kind of dental diseases do dogs tend to get?
Yeah, dogs, most common thing that I see is a broken tooth. Dogs that are chewing will break their teeth sometimes, and that fracture leaves the pulp exposed and it can cause an abscess to form. I also see dogs with a lot of periodontal disease because they just don't brush their teeth twice a day like we ask them to. But that definitely promotes more bacteria going into the periodontal space, or the space between the tooth and the bone inside their mouth. And that leads to infection and mobility, bone loss and mobility of that tooth, and pain. I also see tumors or growths. Some of those are benign and related to periodontal disease and inflammation, but I also see some that are cancerous as well.
How do I keep my dog's teeth healthy?
Yeah, I think the number one thing you can do to keep your dog's teeth healthy is to brush their teeth every day. There is a plaque tartar cycle that's about 24 hours. So over the course of the day, plaque will build up, and it takes about 24 hours for that plaque to turn into hard calculus. So if you're brushing your dog's teeth every day, then you're preventing all that plaque from turning into hard calculus.
How can I tell if my dog has dental disease?
Yeah, so one of the first signs is bad breath. And so we all laughed that, doggy breath, right? But it's really not a normal thing to have stinky, stinky breath. But you can also see sometimes red gums, you can see swollen gums, you can see fractured teeth, you can see growths. But I think, and in later stages, certainly you can see trouble chewing or drooling, but those are very late stage in the game.
What are the benefits and risks of having my dog's teeth cleaned?
Yeah, so certainly having your dog's teeth cleaned is somewhat of a risk because it is under anesthesia, and that's certainly something we'd be happy to discuss with you. But most dogs, the benefit outweighs the risk. We do a lot to make the anesthesia safer. We monitor them with multi-parameter monitoring system. We have a technician dedicated to making sure that they are safe. They're on a heated waterbed to keep them warm. And also we are not having to use a deep plane of anesthesia to do teeth cleaning. They just need to be really light and just staying still, because nothing that we're going to do is super painful. They just need to hold still. But then the benefit of having their teeth cleaned is that we are able to do x-rays and a full oral exam, and that can tell us a lot about what's going on under the gum line, and that they can't tell us about, and we don't know about unless we look. So we find abscesses and infected teeth all the time that look really normal from the outside. So in order to advocate for your pet, I think it's best if we do dentistry on a regular basis so we can look for those things that they can't tell us are painful. It's amazing. A lot of clients will come in after a teeth cleaning and their patients recovered and tell us how much better their pet feels, and they didn't realize how much it was affecting them before we did the teeth cleaning. So it's super rewarding to hear that we're making the lives better for all our patients.